Good afternoon, everyone. My name is Jonathan Alboum, and I'm the Principal Digital Strategist for the federal government at ServiceNow. One of the best parts of my job at ServiceNow is getting to speak with CIOs regarding their digital transformations and related challenges. So today, I'm really excited that as part of the Genius Machines Virtual Summit, I have the pleasure of speaking with Pat Flanders, CIO for the Defense Health Agency. Hi, Pat.
Hi.
So, Pat, it's great to talk to you. Let's get started with you giving us a short background about yourself and your role at DHA.
So I am the Chief Information Officer for the Defense Health Agency, and I also have another name. It's called the Deputy Assistant Director for Information Operations. And so if you ever are looking at anything official, you might see that as well. My background, I spent 29 years in the Army as an acquisition officer, and I had responsibility for a lot of large software implementations, mostly in the realm of logistics. I retired, and I got this job about 3 years ago. And here it's kind of interesting. The CIO here at the Defense Health Agency has responsibility for the networks, development of the software, as well as cyber, and procurement of infrastructure and associated hardware, which in the services, that's more distributed, kind of chopped up.
So, Pat, give us a 2-second overview of what the role of DHA is in the government.
So we run all of the military treatment facilities. So that's the military way of saying hospitals and clinics. And we're actually in kind of a period of transition right now. We don't actually run them all yet. We are taking them over from the Army, Navy, and Air Force. Prior to the establishment of DHA, the services ran them. And so what's interesting about that is it allows us to kind of integrate and single up processes for care to patients. So there isn't going to be an Army way, a Navy way, an Air Force way, and the experience as you go to individual hospitals is actually the same.
So, we want to talk a little bit about risk and resilience today, and that change you're describing of, consolidating those services, I think make the topic of risk and resilience even more, important to you than before. So when we think about this idea of risk and being a resilient organization, you have to make sure that the systems are always going to be there when you need them, and the services are going to be relying on you clearly. So what are the kinds of things and things you do and the challenges you face in ensuring that systems are available when DHA needs them, and your customers need them?
So the real cancer is we own one of everything. And so, as I said, we're taking over management and administration of the treatment facilities. Well, heretofore, the individual services, and in many cases, the individual treatment facilities, bought their own stuff, developed their own stuff. And so we are all chopped up. And so that's the biggest problem, because when you own one of everything, it's very difficult to establish consistent processes to ensure everything is secured. Instead of doing risk management framework evaluation of 5 kinds of device for a certain medical procedure, well, maybe you're doing 30. And it just takes too much. And the same is true of software. Across the landscape of software that we use to run the facilities, we have a system that's used for inpatient medical records, a system that's used for outpatient. We have a system that tries to put those two things together, and there's just all these systems that attempt to pull all of these disparate systems back together. So all of that is being modernized. And the 2 big modernizations I have are 4 networks into one, 4 legacy networks into one, and these many medical systems, of which it's a distributed system. So although I say there's an inpatient system, well, there's 52 instances of it all configured differently. And all of that is coming together under a new electronic health record system called Military Health System Genesis. So those are our two big initiatives. And then on the heels of that, we're also singling up on the people. Right? So there are 200 small contracts out there across the military health system for things like touch labor and IT personnel. And so we're trying to single those up as well. So a very large series of contracts that we're going to be awarding in the next couple years. The first one, that's the call order went out, I think, last Friday.
So they have an environment that's very fragmented, it sounds like, and you're taking steps to make it more simpler, less complex. And in doing that, you need to operationalize some aspects of your business to drive simplicity, less complexity, and ideally less risk. Where do you begin in that process? You know, you're going to modernize systems, but how do you make sure that things are working the way you need them to work?
Well, the way we began the transformation of DHA, like I said, taking over management and administration of these treatment facilities, was not with the actual command, not with the actual chain of command. It actually started with IT. So whereas we have only taken over the first 4 markets associated with the actual management and administration, control of those facilities, for IT, we took them all over in 2014. So step 1 was singling up the networks, because on all these different networks, I didn't have visibility of what was on them, the ability to secure them, the ability of my cybersecurity service provider to monitor them, because they were all different products procured by the individual services. So it all started with that. The new network is called the Medical Community of Interest, or MEDCOI, and it's very deliberately architected with a 12-zone security architecture. Basically, it's the same set of VLANs at each facility. A single Active Directory, a single set of tools that we install on the network and in the enclaves so that we can monitor, and a singling up of the security stacks and associated hardware.
So you created that from scratch and then migrated the networks and various technologies you inherited to the new thing?
Yes. So basically, it's like from the ground up engineered architecture specifically designed for this, that we worked with the Defense Information Systems Agency on, all of the rules for cloud access points and how our gateways are configured. For anybody that follows the Department of Defense, the name of the overarching military network is the DOD, the Department of Defense Information Network. And in there, you have different networks. The 2 big ones are the NIPRNet and the SIPRNet. So one is classified, one is unclassified. We're actually outside of those 2. So we really do run our own network. It's called a mission partner environment. So,
and do you feel those changes have increased your operational resilience and decreased your risk? I assume.
Oh, it's huge. Everything. It's the singled up processes, the singled up ability to monitor and defend, the singled up help desk, the singled up tools. It's just massively more efficient and productive. And we're not done. We're probably, everyone has started the transition. All the sites have started. I'd say about 60% of them are what I would consider done. There are some instances where, if you go into a hospital, you can picture the basement of a hospital, and there's, the old network, the new network. We've migrated everything over except a few things that we don't want on our network. Prefer to leave them on the old one, and they're going to be shut down rather than migrated.
Yeah, well, I mean, it sounds like a good plan. Create some formality, like we were talking about, around how you manage risk. I spent a number of years in the government myself before working at ServiceNow and as a CIO, and I relied on the risk management framework. You mentioned the RMF as well. I liked it because you could tailor the controls to the systems you were managing. Can you talk a little bit about how you're using RMF and any challenges that you're encountering?
So we use RMF extensively, and RMF prior to the new network was really, it's not an easy thing to do, and full accreditation and authorizations for the systems that require it. But when you have 4 different networks and everybody buying everything, well, then it's hundreds of times harder.
Right.
So a key enabler to being able to efficiently do RMF was our network. When we engineered it so that at every facility, the same 12-zone VLAN architecture was set up and the same tools, the same set of compute and infrastructure. And by doing that, now, when it comes time to put the devices on the network, well, once someone accredits it somewhere on the network, you can basically use it anywhere. It's not quite that easy, but it's way easier than it was before because we have the same configuration within the facilities. So that was just a huge thing. The other thing is just good.
Well, I was going to say, that's one of the great advantages you have from building your network from the ground up. It took a pretty wise approach as opposed to trying to make something work. You took the risk of building something new. So see the real advantage there.
Yep, and we use the same system to enforce EMAS and document RMF. And the name of the system is EMAS, and I don't know what it stands for, so I can't tell you what the acronym is.
Right.
But it's essentially the documentation tool that we use to document all of those RMF controls.
Mm-hmm. Well, so I've talked to a lot of CIOs about the RMF and these topics, and it seems like having an integrated approach like you're describing is really important. Being able to break down silos and make cross-functional process automation, continuous authorization a reality is something that's integral to successful risk management and RMF implementation. Can you talk a little bit more maybe about how you're continuing to homogenize the network and be more consistent across all of DHA with your systems and risk management approaches?
Yep. So one big thing is instrumentation, and so we have instrumented the network now with some very, very good tools, enterprise tools that help give us visibility, things like Tanium, Palo Altos, a system called Armis that we use in conjunction with those to help monitor traffic on the network. Really interesting product. The way we've implemented it really allows us to enforce compliance. And so we're real happy about that. But then just the ever-present management of money and looking and knowing what all the MTFs are actually buying so that I can go out and look for places where, 65% of the treatment facilities already own product A.
Right.
And then, the rest own 27 different products. Maybe we should single up on those. Maybe we should look at some kind of competitive award, those kinds of things.
Well, I think that's a call for software asset management technology to support software asset management, hardware asset management, broader IT asset management kind of approach, so you can reap some of those savings and apply those back into your environment.
And that's where ServiceNow comes in.
Well, it is something that consistently makes a difference. I found in environments. But Pat, we're getting close to the end of our time. I wanted to give you a chance to share any final thoughts or lessons learned with our audience.
I think the COVID pandemic really opened up people's eyes about the ability to get into a military network from the outside. And so whereas we corporately, the Department of Defense, has specifically and purposely designed our networks not to let people in. When your own people are all working at home from a massive scale, yeah, we had to do some things. So DISA implemented kind of an emergency stand-up of Microsoft Teams called the CVR program. And basically it allows you to use your home PC to do business with the military. Share text, share screens, things like that. And so that kind of thing going forward, there was a big realization that the DOD needs a capability. We need to be closed for when we need to be closed, but we also need to be able to share in a way that we haven't really enabled up until now.
Well, I think COVID showed all of us that we need to have open minds and be flexible when it comes to technology and managing risk and accepting risk. So, Pat, thanks for your insightful comments. It definitely sounds like you and your team at DHA are implementing some best practices around managing risk and ensuring operational resiliency. So thanks for joining us and best of luck in the future.
Thank you very much. Have a great week.
All right.